I'd like to introduce you to my guest. This is guest number 1, 2, 3, 4, 5.
And I'm number 6.
Thank you all for joining me. As an intensive care nurse, I have witnessed the good, the bad, and the ugly death. I'm here today to talk to you about palliative care. When used appropriately, palliative care can drastically improve the end-of-life care and prevent some of the ugly deaths that I've witnessed. Today I will define palliative care, clarify or disclose the objectives of palliative care, and also talk about some of the myths surrounding palliative care. And who knows, after we're done, maybe you will join me on my quest to help provide excellence in end-of-life care. So let's get started. We're going to start first by defining palliative care. The World Health Organization defines palliative care as the active total care of patients whose disease is not responsive to curative treatment. That's a very long, drawn-out discussion that simply says it's a healthcare approach, it's fairly new, and it's aimed at not curing your disease, but making your life better while you're here, because there is no cure for your disease, and making you comfortable while you're here. It includes caring for the loved ones who also go through a process during this end-of-life stage, and kind of keeps everybody on the same page of enjoying what we have or what time we have here together while the patient or the individual is still here. The objectives of palliative care are, to me, the most significantly one is to affirm life and regard death as a normal process. Everybody has to die. We all have to get comfortable with that main deal. It used to be you couldn't control how you die. Palliative care provides you measures of self-control. You get to participate in what types of care or processes or symptoms you're willing to go through to help improve the quality of your life while you're here. The disease can't be cured, but I can live a whole lot better if I use palliative care. It also provides relief from pain and other distressing symptoms. It integrates psychological and spiritual aspects of care. And it offers support system to help the family cope during the illnesses and afterwards in the bereavement process. Some myths about palliative care includes, if I accept palliative care, my doctors have given up on me. I've heard this many times before. It doesn't mean that your doctors are giving up on you. When palliative care is proposed, it means that they've accepted the fact that they can't cure you, and they want to make your last days as comfortable as possible. So palliative care is introduced to help you enjoy the time you have and as comfortable as a position as you can. Does palliative care mean no more treatment? No, treatments can continue during palliative care. The goal is just different. It's no longer aimed at curing your disease. If you have a tumor and the tumor can be reduced in size to decrease the amount of pain you feel from that tumor or to improve the quality of breathing or your respiratory function, then palliative care would, I would say they would agree to that type of treatment because it helps improve the quality of your life. They're not trying to cure the cancer per se. Palliative care is for old people. I've heard that a lot. People say you have to be old or have AIDS or have cancer in order to have palliative care. That is not true. Palliative care is end-of-life care, and people from all walks of life, some are born into the imminent fact that they're going to die within a short period of time. Children are born with very bad terminal illnesses, and they automatically are introduced into the palliative care program to help the parents deal with the process of dying, even though this child has just been born. So it does affect more than just old people. I can only get palliative care if I'm in a hospital. Palliative care services are offered in communities. Again, it's care at the end of life. It can be given in the hospital, a standalone residence, or at home, depending on the resources available. And finally, I will have no control if I agree to palliative care. Palliative care is a specialty in medicine, just like cardiologists and pediatrics. None of these specialties take over. They simply consult with the patient and helping to provide specialized care in their area. And again, palliative care is aimed at controlling the symptoms and improving your end of life. You can learn more about palliative care by visiting some of these websites. Center to Advanced Palliative Care website is a great one. I like this Pediatric of Nursing. There's an article about a child who was born with a terminal illnesses, and it discussed how the doctors introduced palliative care to this family, and it actually worked out wonderfully. In conclusion, I'd just like to say that people or nurses who provide information on support palliative care are offering their patients an alternative to life support. They are offering end-of-life support. That concludes my discussion here. I hope that I have welcomed you aboard my train of breaking the barriers and promoting excellence in end-of-care life. Any questions? Yes, ma'am.
What type of patients qualify for palliative care?
Again, we have all types of patients that can qualify for palliative care. People who have end-stage heart disease or end-stage COPD. It also includes people that have AIDS and cancers, but 50% of people on palliative care include people who don't fall in that category, and there are adults and children as well. Yes, ma'am.
Are hospice and palliative care the same?
No. Hospice is introduced at the end of your curative disease treatment when there's nothing else left, and it usually lasts up to 6 months. There is no time limit on palliative care, and it can be integrated with your curative treatments. So no, they're not the same.
And does most insurances pay for this, or how does that work?
In fact, most insurances are coming around to paying for palliative care. We also have Medicare and Medicaid on board. So yes, to answer your question, most insurances do pay for that. And if that is it, I thank you for your time. And again, I hope that you will join me on my quest. Thank you.
Thank you.